Carpal tunnel syndrome is when the nerve, it's specifically the median nerve, normally it passes through under ligaments into the wrist and then innervates your first three fingers. So what happens in carpal tunnel syndrome is that you get a swelling of the wrist, of the space in that wrist joint where the ligament covers over and causes some compression on that nerve. So as your day is going on and you're doing a repetitive motion, you're going to notice that you are starting to lose a firm grasp on things. You might be dropping things. It's common to have tingling and numbness in your first three fingers. And then this ultimately leads to pain, and even sometimes pain that goes up the forearm. And that's all from the swelling that's happening inside of that restricted space. So what are the treatment options? We always start things with the most conservative treatment: bracing, rest, ice, therapy. If that doesn't work after, a month or so, we progress and we could do something called a steroid injection, which can help decrease the inflammation. And then ultimately, if that doesn't work, we do something called a carpal tunnel release, where an orthopedic surgeon will go in there and just do a little small incision. This is an outpatient, very easy procedure where they just kind of open that ligament and release the tension in that space. Sometimes if the diagnosis is a little mixed, your physician might ask you to do something called an EMG test. EMG test will read the strength and speed of conduction of the nerves from the neck to the fingers, and that can help kind of confirm the diagnosis of carpal tunnel syndrome.